Acamprosate is a medication that is FDA approved for the treatment of alcohol use disorder. We know that chronic unhealthy alcohol use can result in changes in an individual's brain and result in the upregulation of glutamate neurotransmitters. Acamprosate is believed to counteract this imbalance by interacting with glutamate neurotransmitters and helps to restore this balance. Notably, it should not be used to treat acute alcohol withdrawal symptoms. For some patients on this medication, it can help them decrease alcohol cravings as well as decrease the positive reinforcement associated with alcohol use. A typical dose for this medication is 606 milligrams 3 times a day, which is a regimen of 2 pills 3 times a day. When we compare it to other medications for alcohol use disorder, like naltrexone and disulfiram, which are generally taken once daily, acamprosate can be a challenge for some individuals to take. This medication has a good foundation of evidence to support its use as an anti craving medication. And a recent meta analysis demonstrated that can help prevent return to drinking with an estimated number needed to treat for return to any drinking of 11. And acamprosate has also been shown to reduce the percent of drinking days and heavy drinking days. And studies also show that it can reduce all cause mortality for individuals with alcohol associated liver disease. Generally, this medication is well tolerated. The most common reported side effect is diarrhea, and other side effects can occur, such as nausea, nervousness, and fatigue, though they tend to be mild and transient in nature. Clinical trials have shown that there can be a very small but important increased risk of suicidal thinking in patients on acamprosate, so clinicians should monitor for this adverse effect. Worsening mood symptoms can also occur in the context of a return to alcohol use and should be monitored in patients with alcohol use disorder. So, for an individual with a history of depression, it would not prevent me from starting this medication, but patients should receive screening for depression and suicidal thoughts. Camprosate may be considered over other options like naltrexone and disulfiram, such as the following. For patients who are unable to take naltrexone for alcohol use disorder because of decompensated liver disease or because of long term opioid use or opioid use disorder treatment, acamprosate can be a great option. In my clinical practice, if there is a contraindication to naltrexone or if they didn't meet their treatment goals on another medication for alcohol use disorder, I'll often offer acamprosate next or in addition to the other medication. I do want to note that acamprosate was studied in patients who had already completed medically supervised withdrawal, sometimes called detox, and thus were already abstinent at the time of starting the medication. So, for a patient who is non abstinent or not necessarily seeking abstinence as their primary treatment goal, I will still offer a trial of this medication if another medication, such as naltrexone, could not meet their needs, as the potential benefits outweigh the risks. Given the large pill burden of acamprosate, it may be helpful to partner with a trusted support system, just as we can do for naltrexone and disulfiram. It's important to be aware of your patient's renal function before starting this medication because is renally metabolized. A decrease in dose is necessary if a patient has a creatinine clearance of 30 to 50 ml per minute to 333 milligrams 3 times a day, and it is contraindicated in patients with a creatinine clearance of less than 30 milliliters per minute. Because it is excreted through the kidneys, it can be safely administered in patients with liver disease, including those with decompensated cirrhosis. In addition, a 3 times a day dosing regimen can be very challenging for patients to adhere to and should be discussed with patients when selecting a medication for alcohol use disorder. Notably, while it is not an FDA approved regimen, twice daily dosing of 999 milligrams twice daily does have some evidence to support its use. So you can consider talking to patients about this if they struggle to adhere regularly to 3 times a day medications. Depending on an individual's insurance coverage, this medication may be cost prohibitive compared to naltrexone and disulfiram, so be sure to check that the medication is affordable for your patient. This medication is safe and effective and is often well tolerated by patients. I really think it's underutilized and it's often safer and better tolerated than many of the other medications I prescribe in primary care. So don't be afraid to use it. Start today. You are ready. You are equipped with the information you need.